Hello, I'm Dustin Moore, and I'm a researcher at the Health Workforce Technical Assistance Center at the Center for Health Workforce Studies at the University of Albany. Today, I will be presenting a poster titled Examining Trends in COVID-19 and the Health Workforce through collecting media resources and conducting key informant interviews. Our research examined publications about the impacts of the COVID-19 pandemic on the health workforce in the United States, as well as conducting interviews with key informants. We tracked these trends throughout the pandemic to help provide context and understanding for changes occurring in the health workforce in real time. Our research team created a webpage in April of 2020, which was used to aggregate publications, including interviews, news articles, research articles, press releases, executive orders, and other relevant and important information about the health workforce in the pandemic. The gathered resources were matched thematically. Categories such as vaccine information, health workforce safety, and telehealth are some examples of the various themes. We also conducted key informant interviews with individuals, including state primary care officers, health workforce researchers, and hospital administrators, among others, in order to inform our search for resources and contextualize the changes in the health workforce. Overall, the primary results of our research found that pandemic-related provider mental and personal health risks remained a dominant concern throughout the pandemic. Personal protective equipment was seen as concern early in the pandemic and then faded as time went on. Organizational safety procedures and guidelines was most relevant when planning initial reactions to the onset of cases of COVID-19 in April of 2020, as well as with the release of the vaccine for the health workforce in December of 2020. We also observed that the regulation of telehealth, be it via executive orders or legislative changes at the state, regional, and national levels, was main focus throughout the pandemic, followed closely with resources looking at the consumer use and satisfaction with telehealth services. Interestingly, there was a wave pattern in trends regarding the information about the COVID-19 vaccine for the health workforce. There was a peak in information about access for healthcare workers in December of 2020. This was followed by a peak in information about vaccine hesitancy among health workforce in January of 2021. And then finally, a third peak in information about the distribution of vaccines among the health workforce came in February of 2021. While research on the impact of the COVID-19 pandemic on the health workforce is ongoing and will continue to occur for years to come, evaluating trends and tracking changes can help to better prepare for future pandemics and give insight on short and long-term changes expected to come to the health workforce. Thank you.